Quality healthcare matters in life, and Harbor Beach Community Hospital is no exception.
I'm Dr. Melody Angel. I'm the ER physician.
My name is Randy Okuman. I'm a physical therapist here in Harbor Beach Community Hospital.
I'm an RN, and I'm the Emergency Services Director here at the hospital.
I'm Warren Ramsey, Instructor Coordinator and Manager of the Eastern Huron Ambulance Service here in Harbor Beach.
I'm board certified in family practice. I did a residency in family practice. And then I also have become board certified in emergency medicine.
I also work on acute care, taking care of inpatients. I take care of emergency room patients. And I also work preoperatively and postoperatively.
We are a basic life support ambulance service providing care for the sick and injured outside of the hospital setting and transporting to the hospital.
We take our job very seriously. All of our nurses are trained in ACLS, Advanced Cardiac Life Support. We also are trained in Pediatric Advanced Life Support, and some nurses are trained in Emergency Nurse Pediatric course. We also have some nurses that are certified in Trauma Nurse Core course.
It's really important, that first stage. We have, ambulance service that's able to get out to you and then get you to a medical facility where you can start getting medications, IVs, EKGs, CTs, all that type of thing to define what's going on.
When we bring a patient into the hospital, my crew and our staff, one of the most exciting things that happens is now we have the confidence when we come into this hospital with a patient that they are going to be treated quickly, efficiently, and professionally, and they will receive medical care in a very short period of time. And that gives us a lot of encouragement, and we, as we're picking people up out in the field, we can reinforce that encouragement with them so that they feel comfortable with the fact that we're going into the closest facility and a very high quality facility. 24
hours a day, we have RNs staffed around the clock that are trained in ACLS and Pediatric Advanced Life Support, and some with Trauma Core. We have a doctor that's board certified 24 hours a day who's available, who's here.
If someone has, acute pain in their chest or their abdomen, or they've had an injury of some kind, to get initial care, to get the bleeding stopped, or to get, if they're having a heart attack, they need to come here and we need to, get aspirin in them and nitroglycerin and possibly give them a clot buster, what we call a lytic, and then we can get them moved on to the next stage of being able to get help. But a lot of times there's a timetable where, like with a stroke, you have, a 3-hour window when you start to get stroke symptoms. The treatment, if there's certain kinds of treatments that if they're eligible for them, need to start within 3 hours.
It was very unlikely that you're going to come to our emergency room and not see a doctor within 15 minutes.
It's important to have really excellent skills of stabilizing somebody here, and we're very fortunate to have a lot of the tools to be able to do that, a great staff.
So that confidence builder was tremendous since we've gone from call-in physicians to PAs to physicians in the hospital all the time. That just creates an environment that is nothing but positive for the patient, for the nursing staff. It gives confidence to a lot of people to take care of a person that is sick or injured.
When we first started here, our ER was on the other side of the building. And so we have all of our staff on this side of the building, and then we'd have to split our staff in half to take care of the acute care patients and the ER patients, where now they're all on the same side so we can all work together. So that's been a real positive thing.
We also have a wonderful physical therapy department and occupational therapy department. They'll come and see patients in the ER even, or if we have them inpatient, they'll come to see them there.
Physical therapy is a treatment of disability by means of physical agents, which is water, heat, electricity. Our job is to give the patient relief from pain, restore function, and prevent further injuries.
He not only takes care of patients, he takes care of the staff too. If he sees you're walking with a limp or you're kind of sore, he says, get over here, and he's going to show you what to do, and he'll help you out there, so that's great.
We deal with very young person, athletes, senior citizen, middle age. Try to provide you a lot of exercise at home so you can duplicate therapy at home, and then we'll give you more when you come here. The technique is to really, you will be able to come here dependent and then get your hips stronger, be able to walk without anything.
I also oversee our walk-in clinic that started in May of 2006. The community wanted a place to go when their doctor's offices were closed. A lot of our families are working now, so they come home at 5 o'clock and daycare tells them their kid's been pulling on their ear all day. Well, your doctor's office is closed and you have to work the next day, so you can bring your child up to the walk-in clinic and doctor can check out the ears. Yep, child's got an ear infection. And you know, we even went a step further. Our pharmacy is closed at 6. Well, I don't want to go all the way to Bad Axe to get my prescription filled, so our Harbor Drug has provided a service where we can start the antibiotic or whatever medication it is until you can get the rest of it filled the next business day. So it's a real nice continuing of care for the busy family, because everybody's busy these days.
For people to be able to come to that, either they're visiting in town, they don't have a local physician, or it's Friday or Saturday and they're not able to get into their local physician.
And when it first started, it was only open a couple hours a day all week, and now it's progressed to 6 hours open during the week and 8 hours on weekends and holidays.
And to have that kind of resource to just be able to not have to make it a whole ER visit, but to get professional physician care every day of the week in Harbor Beach is a fantastic resource.
We have an attached extended care unit in rehab, and it's nice because a lot of times we'll have the patient come to the emergency room. Family can no longer care for the patient at home. We take care of them for a couple days and then they'll go down to our extended care, so it's nice to see them because then we see them go through the halls, go into physical therapy, and we see them improve and get stronger. And a lot of our residents on extended care don't stay forever.
When they come here, the aim is to really discharge them as soon as possible.
Historically, you went to extended care / long-term and you were there for a long time, and now it's not happening, it's more of a rehab.
Before they get admitted here, we have a case conference with the family. Ask the patient and the family what's their goal towards their rehab, and as soon as we can discharge them to a more functional, if they can be able to be alone, or if the caregiver can take care of them with less assistance, that's our aim, to get them back to the community.
Patients are getting stronger and they can go home. They're a real strong staff down there, very team-oriented, and they do a lot of activities with the residents. We have the nice patio outside, so you can see them out there with their family when they come and going for walks. And
we have CAT scan 24/7. We have teleradiology service that we can send it out to, so a certified radiologist can look at every CAT scan that we do 24/7, even if it's Friday night or Sunday night or whatever.
But prior to having our CT unit, we had a mobile unit, so we had to take the patient outside to a trailer, which wasn't very convenient when it was snowy and rainy. Now we have it here in-house.
We have a pretty extensive laboratory service here, actually.
We've got a lot of services. Our specialty clinic has a lot of specialty doctors that we refer our patients to. We have diabetic education now, so our patients who need further care with their diabetes, they can go for education with that.
It's wonderful to have access to that kind of quality care right here in Harbor Beach.
With our tertiary care hospitals, we have Covenant is a real strong ally of ours.
And we have that almost immediate access to getting them in there. We also have a good alliance with St. Mary's as well.
If a patient is critical and needs to be airlifted, as long as weather permitting, we can call them even if we're not quite sure what's going on, but yet we know something critical is going on, so we need to get this patient to a larger facility that has the equipment and the resources that we don't have. We can start their care off, get them stabilized, and then get them to the facility that they need.
We have more and more people that are coming here and seeing some of the stabilization improvement that we've done in the institution, and get the personalized care here as well as the quality medical care.
The most is to really give the patient the best treatment that we can provide here.
And it's nice to trust when you get somebody stabilized here and you send them somewhere else, that you know that they're going to be in good hands, somebody that gives them personalized care as you would here.
We've come a long way. We've got supportive physicians, we've got a supportive administrative staff.
Partly because our staff really cares about the hospital. This is their hospital, this is where they're going to bring their families, and they really want to make sure it's right.
Most of my friends are my patients, which is cool because I know them by their first name basis. I know their husband or wife, I know their kids.
It's just a wonderful privilege to be with people when they're having something as intense as you get in the ER.
You get a lot of satisfaction when someone comes in, they're not feeling well. You can help them feel better, and then later on you see them on the street and they turn around and say, "Oh, weren't you my nurse? Thanks a lot." And
if you're going to go to Harbor Beach Community Hospital, you're not just a number, you're an actual person, and it's family taking care of family. A lot of the people that work within the walls of that facility are somehow related many times to many of the patients we take in, and they treat the patients like they are family. And to me, that's important. You're not just a number, you're not just another person coming through the door, you're actually a patient that they're going to take care of in a quality, efficient manner that cannot be denied.
I'm just really grateful to be in Harbor Beach. It's a small town with a big heart, and it really shows here in the hospital, and it's wonderful to interact with that.